Go ahead, starting.
So this is the setup of the table for the operating room. So we have an extra cup that we open special for everyone. In the lid of the cup, we're going to put all of our sharps. You can come over this way, Jen.
Mm-hmm.
So all of our needles that we haven't opened up yet, our sharps, we can put in the lid of the cup. The cup itself is going to be filled with, or maybe a third of the way filled with BSS that we'll get off of our bottles at the beginning of the case. We have the tubing that we use for I&A. There is a stopcock that we have. You take off the two ends of the stopcock, and then the small end of the tubing goes on the Simcoe. The larger one has to go on the stopcock, and it only goes on one of those two sides. So screw it on one of the two sides. Leave that on so that there's no extra leakage if you put the stop on the wrong direction. That will be connected up into the tubing when we're ready for surgery. All of our blades, we have a crescent blade that we have starting out straight, and then we bend it angled. We have a keratome, and then we have a 15-degree super sharp blade. So we're just taking those out of the packages, but they're still protected in the little gauze pads. We have a multi-pack of Q-tips that we peel back the plastic on. And then stick them somewhere so that the surgeon can grab them. The surgeon might want to do that, as the assistant's doing something else. That's for drying the blood in the beginning of the case. We also have instrument wipe along with the corneal light shield. I don't use the corneal light shield much. The things that I'm not using much, we put underneath the tray. Underneath this tray is the corneal light shield, but also some myostat that we got off the back table that we separate among different cases. We started out with 0.2. I got a little bit extra this time. And then we also have the Trypan Blue that we're using on almost all the cases. We're also going to get an 8.0 Vicryl off the back table. We're cutting it in half. It comes double armed. We're cutting it in half and taking just one of the suture material and sticking it under here because that's at the end of the case, so we don't accidentally poke ourselves with any needle. There we go. We also put up extra, of course, the bottle. I like to throw away things that we open up that we're not using. The gauze will stick inside here so we get it wet. We're also going to need BSS in our 10 cc to squirt on the eye. We also got an extra 10 cc or a squirt bottle we would have got if we had extra squirt bottles. The extra 10 cc is one is for squirting on the eyes, our squirt. The other one is for the Simcoe, to suck for the Simcoe. So we have to flush the Simcoe, so we're going to suck up some fluid for doing that. We also have the 5 cc or 3 cc that we're using for doing the hydrodissection. So all of those are going to want fluid, so I stick them all in the bucket. So once the fluid's in there, we can get all the fluids in there. We have the viscoelastic. This is Celugel viscoelastic. It needs to have a little bit of fluid if we had some, or the Celugel itself in the cannula before you hook them together so there's no air in the system. And then again, all the extras like this is designed to go on side there, but we don't need it. So I'd like to throw away the things that we're not going to use. There's an extra cannula, and that's for the hydrodissection, so I don't have to keep going back and forth between these two. Extra lids that we're not using. And then our white cell sponges are for the end of the case for checking the wound. Most of the blood removal we're using Q-tips. The white cell sponges are for just fine checking if there's any leakage. And so I'm keeping those in the back here somewhere ready to grab if you want them. So that's the tray set up, and then we should be all set for the surgery. Thanks. If you can, let's put the music back on.
It's not stopping. Why is it not stopping?